Good afternoon. We are from Health Solutions Consulting Firm, and we were contacted to address your interest in improving the quality of life in Hamilton. Our team is comprised of interdisciplinary medical professionals. My name is Alicia Walker.
My name is Brenda Velarde.
I'm Elizabeth Reardon.
And I'm Cameron Price.
Thank you, guys. Many of you are familiar with Gabriella's story. She's the third Hamilton teenager to attempt suicide in 2 years. Using Gabriella as our model, we performed a root cause analysis to identify factors that contributed to Gabriella's suicide attempt. While there are many factors that contributed, here are the main ones that we've identified. Gabriella had a poor social support system with no outlets to turn to. She suffered from childhood obesity, which led to a negative self-image, and her poor English and low educational level led to a low sense of self-worth, all of which had a negative effect on her mental well-being and led to this unfortunate event. With the growing influx of migrant families in Hamilton, there's potentially many Gabriellas out there. We're here today to address those factors affecting Gabriella and others like her in the Hamilton community. We are proposing a 3-tier intervention solution program centered around community-driven solutions and based off the Institute for Healthcare Triple Aim framework. Our program will improve the patient experience, improve the health of the Latinx population, and reduce the per capita cost of healthcare. The program is called Salud para Todos, which means health for all. Although Latinos make up the majority of the underserved population, our program is designed to reach all within the target population, regardless of race or ethnicity. The program model incorporates community health workers, known as promotoras, a community garden, and a community coalition. We'll work with local Hamilton medical professionals as well as a variety of community, local, and state organizations to build a cultural collaboration in Hamilton. We're going to begin by talking about our community health workers. We recommend using the promotora model. A promotora is a member of the lay Latinx community trained to navigate the healthcare system and build a bridge between the underserved population and their access to healthcare. As a member of the community, they understand the unique needs of the community. They can reach a sometimes hard to reach population. They speak the same language and share the same culture as many of the community members. The promotoras will provide basic health education, and the education that they're trained in and provide can be tailored based off the needs of the community. Our program will hire 3 part-time promotoras. Their focus at this time will be access to healthcare, education and nutrition, childhood obesity, basic oral hygiene, and mental health. They'll go through an evidence-based intensive training program that will include topics such as the state Medicaid program, government-funded community programs, appropriate use of hospital emergency services, and motivational interviewing. They'll be paired with a local family care practitioner and psychiatrist that they'll meet with on a regular basis to discuss health trends and concerns in the community and other areas in which they can further tailor their outreach. Ongoing training for the promotoras will be done through computer-based training, and they can attend hospital in-services when necessary. Here's an overview of the taskings that the promotoras will perform. They'll identify individuals who are eligible for the Medicaid and assist them when getting signed up. They'll also assess their eligibility for other health services and programs that are available in Hamilton and link them with those programs. If necessary, they can act as patient advocates and translators. The health education will include going into the schools and into the homes and performing anthropometric screenings on the youth. They'll also provide the education on diabetes, nutrition, oral hygiene, and they'll strongly encourage participation in the community garden. While in the home, they can perform environmental and home health assessments, administer psychological screenings, and if necessary, they can perform mental health first aid. All their referrals will be warm referrals, and the patient's progress will be tracked to ensure that there's follow-through with care. The promotoras will fall under the supervision of the Salud para Todos program coordinator. This promotora model has been implemented in other migrant communities in Texas and California that are similarly situated to Hamilton with great success. And we feel it to be very successful here in Hamilton as well. Next, we're going to have Brenda, and she's going to discuss the community garden.
Thank you, Alicia. The second program we will be implementing through the Salud para Todos Triple Aim intervention is called Growing Healthy Kids. Growing Healthy Kids is a pre-existing, evidence-based program that has shown multiple beneficial outcomes. It was first implemented in North Carolina and Texas communities that meet the same socioeconomic status, of low socioeconomic status, migrant agricultural Latinx community members, which is the same population we are targeting in Hamilton. Growing Healthy Kids is going to be a community garden-based prevention as well as intervention that will help recruited Latinx community members decrease the childhood obesity among low-income Latinx children by providing a safe environment where they can grow and play. According to the American Diabetes Association, 20% of Latinx preschool children are already obese, and many of these families that meet these criteria also suffer from food insecurity, language barriers, as well as obesity amongst their children. Multiple evidence also has shown, and from my personal experience of being raised from migrant agricultural Latinx parents, shows that these families also tend to purchase more processed and fast foods for their families because they're trying to stretch their dollars. We have identified to implement the community garden at the local Catholic church. Many individuals in the Latinx community already attend the local Catholic church regularly because of their religious background. Additionally, the local Catholic Church is a place where all community members, besides the Latinx community, can come together to create solutions in a neutral area. Lastly, the church is a safe area where these individuals can practice their shared cultural heritage, as well as speak their native language and learn English without discrimination. Sponsors that we will be working with will be academic, health, and community sponsors in the local Hamilton area. North Carolina and Texas had previously been sponsored by the National Institute of Health as well as the Center of Disease Control. Resources that we will also be collaborating with will be the University Cooperative Extensions as well as the Parks and Recreation to implement Growing Healthy Kids. For the garden site, we will be working very closely with the promotoras to implement recruitment and make sure we are targeting participants to be recruited for the garden. We will also be recruiting bilingual Spanish-speaking individuals to be in charge of the garden to help impact and make sure that everything is working safely and smoothly. For recruitment, promotores will be visiting local schools, Latinx community centers, hospitals, as well as Head Start programs to recruit by word of mouth, referral, or by just having flyers in any sort of sense of marketing. For the participants' role in the garden, this is the most important part of Growing Healthy Kids because we want to know that this is going to impact their lives. And so as we have seen, Growing Healthy Kids is going to be a very safe place where they can learn, grow, and play, as well as be educated on nutrition, diet, and help build family relationships between these communities. Additionally, Growing Healthy Kids had showed beneficial outcomes in North Carolina and Texas that incorporated physical, mental, and economic benefits, and also increasing family participation and relationship building because these families were working together. People like Gabriella had a lack of support system at home because her father was consistently working in the fields. Her mother did not want to leave the home because of a language barrier. Growing Healthy Kids will be able to bring her family together in the garden and other families that are suffering from these tragedies as well to come together and have a shared cultural heritage and remind them that they also share a similar background. Gabriella can also be a mentor, a peer mentor to other individuals coming into the program. They can establish leadership, self-efficacy, and be accountable for implementing ideas in the garden as well. And with this, we know that we will be able to increase self-esteem as well as confidence and be able to build healthy youth in Hamilton. And with this, we know that Gabriella will be able to be provided the tools to be able to increase her quality of life. Methods we will be implementing for the youth will be weekly gardening sessions and 7-week cooking and nutrition workshops, which will be held by the bilingual volunteers, and this is going to be the biggest chunk of diet and nutrition education. A lot of our children do not know where their food comes from, and it's very vital that they know that it's grown and that it has a lot of micronutrients that is important for health. Additionally, we will be doing quantitative and qualitative data assessments to make sure we will have an impact on Growing Healthy Kids and all of our other programs. For families, you will be having social events such as harvest festivals and health fairs to educate these families to close the gap again between healthcare. With this, we also expect to close the gap between the seasonal and the yearly agricultural workers to have them come together and share their backgrounds. We will also have the bilingual volunteers and the promoters working closely with the families to report on availability of fruit and vegetable consumption in the household as well as consumption with their children. Expected outcomes that we will be seeing, which also was seen in North Carolina and Texas Growing Healthy Kids, was to achieve a healthy BMI or maintain one with their youth. We also will be seeing an increase in fruit and vegetable consumption as well as fruit and vegetable availability in the home. And again, we also will be establishing a safe learning environment where we will be promoting wellness as well as mental health and decreasing childhood obesity amongst the youth in Hamilton. Now I'm going to be passing it on to Elizabeth, who will be talking about our community coalition.
Thank you, Brenda. The third component of Salud para Todos is a community coalition that serves as a mechanism to improve communication and sustainability for the program. This primarily consists of a panel of community stakeholders, people who are from Hamilton. They could be economic actors, health professionals, the promotores themselves, or the Hamilton families who have a vested interest in seeing this program succeed. One of the key members of this coalition will be the Silver Lake Canning Company. We're going to ask them to start donating their excess produce to Hamilton's schools, hospitals, churches, and food bank. Canning companies of this size in the U.S. and agricultural companies in the U.S. waste up to 2/5 of their edible produce every season because they can't use it for their products. But there's no reason that shouldn't be going back to Hamilton's families. This will provide the canning company with an opportunity to make a tax-deductible contribution to the community, and that will serve as their incentive for participating. Additionally, this will improve relationships between the canning company and their employees, the Hamilton families. Families in poverty in the United States spend significantly less of their food budgets on fresh produce, and this will be a way to mitigate that problem and additionally incentivize Hamilton families to participate in this panel of stakeholders. Now, this is best seen using the social ecological model. Nutrition interventions in the United States, like Growing Healthy Kids, are significantly more effective when they address systems-level barriers and utilize changes to public policy. And so we're going to be investing in health and education, while additionally encouraging individual participation and improving self-efficacy, knowledge, and attitudes about the situation as it stands. As a result, we're going to be seeing interprofessional cooperation and accountability, as well as support system strengthening at both the family and community levels. Now, Cam is going to talk about some of the external programs that will make this even more sustainable for us.
Thank you, Elizabeth. So throughout the course of our evaluation, we were looking for high-impact, low-cost ways that we could work to improve community access to care for all Hamiltonians. We quickly identified the obvious health structures, the hospital, the critical access hospital, Hamilton Hospital, and the federally qualified health center as being a large place to roll out or expand from. We came up with 3 recommendations for programmatic initiatives, or in some cases expansion, and I'm going to tell you a little bit about them right now. Both of these facilities already receive 101% reimbursement through Medicaid programs. Excuse me. By using our promotoras as a means to identify and enroll members of the community, not just the Latinx community, but anyone who may not know how to negotiate the healthcare system, this would serve as a way to help people get into the Medicaid coverage that they might be eligible for. This would have a twofold effect. It would expand the access to care for the community members who are now able to go to the doctor, go to the hospital, etc. It would also, for critical access and rural hospitals, revenue can be something that they have to think about on a regular basis. And by bolstering the pool of people that they're going to get reimbursed for visits, for ER visits, etc., it would help in the long run to build a more sustainable community infrastructure for these facilities. The second was the National Health Service Corps Loan Forgiveness Program. By enrolling in this program, and we'd be able to incentivize creation of positions for a clinical pharmacist, behavioral health nurse practitioner, a family medicine physician, and a dentist. Positions that we need in most rural communities, but specifically that we identified in Hamilton. Loan forgiveness statistics show that even after the period when people have served in their rural or underserved community, that they're 85% likely to stick around for past 2 years and 50% likely to stick around past 5 years. So this would have not only the effect of creating a more bolstered community health system, but it would also hopefully retain some of these people over time. Attrition is a common concern in rural communities for health facilities. The third is the 340B pharmacy program, which one or both of these facilities could enroll in. It allows for purchasing of drugs in mass, which applies a discount, which then would be reimbursable to the full amount for the facilities that are involved in it. It's commonly used in specialty clinics, HIV clinics, but it's also something that's accessible for these institutions and could provide a new stream of revenue, which over time could be fed back into some of these programs, these community health programs. So let's take it back to Gabriella. We identified 3 critical risks that she faced. Those were obesity, poor mental health, and poor social support systems. This is not something that's isolated to this community. Latinx populations, specifically teenage populations across the country, are at an increased disproportionate risk of suicide. We wanted to, as a part of this, try to turn it around, see what we could get at, find underlying commonalities between those factors so that we could hopefully improve all 3 of them. Again and again, access to care was the common problem, and that exists not just structurally, physically, and oftentimes with regard to patient education or what the community might not know that they're eligible for. By utilizing our multiple arms to our program, our promotoras being the sort of face and ground crew, the long-term initiatives to try to create sustainability as these programs develop and grow, they all attempt to get at that access to care issue. I'm going to hand it back to Elizabeth now to close out.
All right. Thank you. In your appendix, you will see the timeline, which we've gone ahead and stretched out over 2 years. We recommend that this panel today agrees to fund the program for the first 2 years as we move towards sustainability. The budget is outlined in your appendix as well, but I really want to focus right now on the benefits that Hamilton will see from implementing Salud para Todos. In the United States, obesity costs an individual $1,300 per year that they are obese. And if we're able to eliminate obesity in just one individual out of 20 households through our Promotora program with the Community Garden, that's a savings of $26,000 per year for Hamilton's families and individuals. Additionally, mental health emergency room visits, like the one Gabriella recently experienced, cost $31,000, including hospitalization, monitoring, and follow-up. And again, if we're able to eliminate just one of those out of only 20 Hamilton households through the Promotora mental health screenings and through improved environment through participation in the community garden, that's $620,000 in savings. The Promotoras alleviate the caseload burden on the health system to the tune of $30,000 per Promotora per 10 cases they take on, and that's a minimum 10 cases, and we imagine that our Promotoras will be taking on more than that. And so if we hired just 3 of these Promotoras, that's $90,000 per year that the health system is not having to cover in terms of people not going to the right place the first time. Additionally, general emergency room visits cost nearly $4,000, and these are often mitigated through preventive care or through getting folks to the right provider and using the right resources when they are insured. And again, we're expecting to save $73,000 out over 20 emergency room visits saved. That's a total savings at minimum of $809,000 in just the first year. So for every $1 this panel commits today, you're going to see a return of at least $4. As we conclude today, we just want to remind you of Gabriella and ask that you think of her and other youth like her in Hamilton, in the state, and across the nation who are struggling to see hope for their futures. And because of structural barriers, because of issues like childhood obesity, poor mental health, and lack of economic opportunity, that we have that opportunity to make an influence on today. We wanted to leave you with this quote, that when I becomes we, illness becomes wellness. So let's collaborate. Thank you. We're happy to take any questions at this time.
So congratulations to all of you. That was actually a wonderful presentation, so thank you.
Thank you.
I was particularly pleased to see you engage the community to the level that you did in terms of stakeholders and using the model that you put forward, and also your cost structure is pretty low. Initial question would be initial funding of $178,000 over a period of time. Where do you propose those people hang out? The hospital, the community health center, the Catholic Church? Where would they be hanging? And then kind of how do you actually envision the sustainability moving forward?
The budget actually includes funds for office space rent and overhead charges as well. We've limited indirect charges to 15% to cover consulting fees in the future as well. In terms of long-term, we've identified many grants across the country that focus on promotora programs and community gardening programs. Additionally, a lot of those first-year costs, especially for the garden, are one-time fees, so purchases of starter seeds, of equipment, etc. And then additionally, throughout Hamilton, there are, as we mentioned, people who are committed to seeing this program succeed and who are willing to put forward in-kind or cash donations to perpetuate this program. Does that answer your question?
Yes.
Well, thank you so much. It was a great presentation, very organized, and I like the name. Why do you think the healthcare personnel should spend like more time with that community where they live? Why is that so important?
I think it's important to have that relationship. They need to build that rapport, and a lot of the people in Hamilton, in order to be able to be reached, we have to go to the community. We can't be outside trying to say we're going to benefit your lives when we're not really in there impacting them one-on-one. And so that's why it's so important that we're literally going to them and telling them how this is going to benefit them and their families and how it is going to be sustainable for them in the future.
Can I add to that? I'd also like to say, if you look at some of the trends that are emerging in healthcare, one of the things is the management of chronic illnesses and the prevention of chronic illnesses is moved to a community setting. And so in order to address that population, we have to incorporate basic public health principles as well as our medical knowledge as well. And so what our program, the goal of our program is to promote collaboration between the two and get the two talking and hopefully on the same page. So that way we can address it properly and make a difference.
Thank you for the presentation. Just to echo these comments, it was very professional and well organized, so thanks for that. I also like some clever things you did by placing the garden at the church. That was a little unique. And then engaging the Silver Lake Canning Company was nice. And as soon as I was going to ask about incentives, you had something on the slide, so that was great. When looking at your model, though, and you did a nice job outlining it, no model's perfect, right? There's going to be inherent flaws or particular failure points. So is there a failure point that you can proactively identify or maybe talk about, like a challenge you're going to have, and then what you would do to then address that particular failure point?
We talked about that quite a bit, and with community, sort of community-based programs, you're heavily reliant on the community, and if the climate changes, either locally or it comes down to like having a diverse amount of people involved whose interests are going to persist throughout the period of time. And we tried to work that in using the businesses and the sort of community leadership that was involved. You can't fully anticipate some of the funding changes that might happen, but we attempted to at least get at that with having sort of a diverse and growing sort of system of how we're going to get funding for things, how we're going to adapt to community needs. The idea was to start small with a few promotoras, and then if it were possible to gain enough traction to take off, then more promotoras, more national grants could be applied for, things like that. I don't know if I'm getting it.
No, I think you are. I think you want to shield yourself as much as you can. Right? So relying on grants is not a sustainable plan.
Climate changes rapidly.
Yeah, and if I could add to that, being so community-based and so reliant on Hamilton actors is actually a protective factor to a large extent, because we're in a very unsure climate right now about healthcare in this country, about immigration in this country, about agricultural laws in this country. And being able to bring this community together, bring these two fairly separate factions together into one community where they feel as one community will be an important way that this will be sustained.
Mm-hmm.
I think one of the things I thought I was particularly struck by, because we talked about the cases judges last night, and one is that you identified that there was a asset in the community called Medicaid, but you have to get people signed up. So using the promotoras to do that, very good. I was very happy that you focused on the FQHC and recruitment of folks and the 340B pricing thing. The only challenge, of course, being getting the folks that run the CHC to agree with you to initiate what they need to do in terms of opening the positions and so forth. But again, that very, very innovative approach. So, this isn't a question, it's more of a comment, but I think that's the FQHC, maybe a little bit more of a challenge as you go into it to change their world, which they may be very happy with, potentially. Speak from experience.
All right, I'll ask another question real quick. Sure. Measures of success. So you give the 2-year model. There were some outcome measures in there. But what other measures might you use as kind of mile markers along the way to know whether all the stuff that you're doing is leading to a successful overall approach in the community?
Well, I was just going to speak for the garden because I know this is an evidence-based program, and for us, we did have weekly surveys that we would be collecting that would be eventually implemented into a standardized deviation or some sort of test that they did to check the deviation and see if there was an impact, and there was. And so for us, that is what we're going to be doing to make sure we are having an impact with these participants, having the weekly surveys and also having monthly meetings with these collaborators and these leaders coming together to impact food insecurity as well as safety and participation, building up these families. And so for us, it's going to be weekly as well as monthly evaluations to make sure that we're on the right track.
I was also going to add, the original plan was to also have the promotorists start collecting some of the information on who was making it to appointments, what sorts of things they needed to do to get people to appointments. One of the hopes and aims was to track the number of completed appointments for new patients or for total patients at some of the facilities to see if there was an increase. I think after a year, something like we were hoping that a quarter more patients would complete an establishment visit at either or both.
So, I think we'll have more questions. And so, in terms of engaging the community, you focused on the Catholic Church, which I think is a great idea. How would you consider kind of connecting with the, 40%, 50%, 60% of Hamilton that's not Catholic and engaging them in this process?
I think that's a great question because we're not specifically obviously targeting Latinx community members. We're trying to target a whole rural area in general. But for the Growing Healthy Kids, it was specifically targeted for Latinx members, which a lot of me coming from one of them, we were raised Catholic and things like that. And so not being able to target that, eventually in the future, we want to expand the community garden to other individuals that are not a part of the Catholic Church, such as having one start in the Parks and Recreation as like a community garden in the parks, implementing one at the school where Gabrielle attends regularly. And so right now, just the Catholic Church in general is just the best place for us to be able to access people right now that really need food or struggle with food insecurity.
Additionally, this is a component that the Community Coalition can address as well. So people who maybe feel some animosity towards other members of the community, this is a forum for them to come and discuss that and find common ground. Not necessarily in the church, though that is a great starting place, but a place where people who have an interest in Hamilton and the success of Hamilton can come together and see how different facets of the community can work together.
If you can say one more thing, what else could the Migrant Health Center do to improve the health and well-being of this underserved community? If you can mention one more thing that is not there.
For the community garden? Or?
Yeah. No.
It was about the Migrant Health Center?
Yeah.
Oh.
We had thrown around a lot of ideas in the beginning stages. Rural communities, it tends to come down to access a lot of the time. Like people can't make it, even if they're only a few miles away. Land expanses can be vast. So we had thrown around mobile health, telemedicine.
Okay.
Saved by the bell.
Thank you.
Thank you, guys.